Great patient and public involvement is much more than meetings in community centres when we have ideas to present or when we want to gather views. Instead, it leads to exciting collaborations, inspiring creativity and conversations that generate fresh thinking and wiser actions. We want to showcase a programme of work that has demonstrated each of our principles for working with people and communities. The 11 principles fit neatly under these 6 themes. Be accountable to our people and communities, one size doesn't fit all, start with people and communities, trusted voices are key, invest in people and communities, nurture relationships across our ICS. This work has been led by our Children and Young People's Asthma team to develop an asthma-friendly school programme. The programme encourages schools to welcome children with asthma and put simple strategies in place to ensure they can fully participate in school life. 1 in 11 children in the UK have asthma, and 2 to 3 children in every school class will have asthma. That's why it's important that children feel safe at school, that parents feel confident to send their children to school, and that children with asthma can fully participate, just like any other child, in all elements of school life. By being supported both at home and school to proactively manage their asthma, children do not need to miss out. In February 2024, we celebrated the first local school in Dudley, named as the first asthma-friendly school in the Black Country. Let's find out more from our asthma team and teachers and pupils at Caslon Primary School about the programme and how they've brought to life the ICB's principles for involving and working with people and communities. Look out for the icon to highlight the principle.
For us, it was just about making sure that everyone feels that they're welcome in school and it doesn't matter whatever they've got, that they can be in school. It's about helping the children that need it, if they need a bit of time out, if they need their inhaler, about making sure that staff are aware and other children are aware in the classrooms as well. We can do the best by these children and nothing should stop them. If they've got asthma, it shouldn't make them stop. They shouldn't have to not do PE or anything.
So the difference this programme will make to families is that they will be reassured that their children are looked after in school and that their asthma is really well managed.
It's really important for education to co-design with health and for us to work together collaboratively, because we are 2 completely different organisations and it's about coming together with shared understanding and a shared purpose.
So a school nurse who first approached me and said, oh, there's this thing going, I think it might be useful, you might be a great school to join in. So we said yes. Then we had some meetings with Viv and some of the clinical lead nurses to talk about the project and where it was going to go from. Then we spoke to John from the Dog, Duck and Cat Trust because he was doing that new book about asthma. And then we came up with, there was some slides to go out to staff. So all of the children had an assembly led by the school nurse. And then they went into their classes and the specialist nurses and John were around the classes and all of our children got involved in designing a logo. And then one of our children was the one where the logo now is on the actual certificate, and the children had a great time and it's made them more aware of what goes on within school.
So in the assembly it was to make everybody aware of what asthma was, how to treat asthma, so it was what asthma actually was, what part of the body it affects, and then what symptoms young people might experience.
When the teachers told you that your design won, how did it make you feel?
A lot. Oh, I want it. It might help some people know about it, and so if they get it, they know exactly what to do by getting this and everything, and so you're ready for it.
We're very proud, and I must say, as soon as we got the certificate, we printed it out and it's straight up in the reception so anyone can see. It's also on our letterhead, and we informed staff and we informed parents as well.
Our asthma team continues to encourage local schools to become an asthma-friendly school. It will improve asthma awareness and management, reduce absences for pupils with asthma, create an inclusive environment for all those with the condition, and ultimately support the health, safety and well-being of students and staff. We're proud to showcase this work and how it fits with our principles of involving our people and communities. Thanks to all that were involved. More examples of our principles in real life are captured on the Have Your Say web pages of our website. We encourage you to think of other examples we can showcase and highlight our fantastic workforce and the differences they make to our population.